good day everyone. My name is Chohara Cabato of Davao Doctors College from BSN 212E, and for today I'm going to demonstrate to you on how to do the Leopold's maneuver. So before we start the procedure, let's prepare our materials needed. So we need a rolled towel, a blanket, and one pillow, and also a stethoscope. So before we do this procedure, let's wash our hands. It is to deter the spread of microorganisms. Now that we are done washing our hands, let's go and approach our patient. Hi ma'am, good morning. Ako din si Chohara, your nurse care for today. May I look at your armband, ma'am? Okay. Ma'am, can you please dictate your name? Okay, Kate Quaton. And your birthday? Okay, April 18, 1999. So, explain the procedure to the patient to gain the patient's cooperation. Ma'am, this procedure is to identify the presentation, the position or the fetali, the descent degree, and the attitude of the fetus, which is your baby. Also to know that the baby is in a healthy condition or maayo ihang pagtuyok sa imuhang tiyan. Okay. So, before we start the procedure, let the patient empty her bladder before the procedure because a distended bladder may deviate or may slightly deviated the uterus. Okay, ma'am, mani sa tauna for you not to feel discomfort during our palpation. Okay po. So now that the patient has already emptied her bladder, position the patient in a supine with one pillow under her head. With knees slightly flexed. And expose her abdomen only. So let's drape the patient. It is to facilitate accurate measurement and providing comfort, and flex knees can relieve tension to the abdominal musculature. Now, place a rolled towel on the woman's right hip. So, replacing the rolled towel. It is to shift the uterus away from the blood vessels and thus prevent supine hypotensive syndrome. So that if you are right-handed, you may stand at the right side of the patient, also facing the patient. So if you are left-handed, you may stand at the left side of the patient and also facing the patient. To easily grasp the symphysis pubis to be done in the third maneuver. Now let's do the first maneuver, which is the fundal creep. It is to determine whether the fetal head or the bridge or the buttocks is in the fundus. So our patient is 36 months pregnant. So we have to face the patient and palpate the uterine fundus to determine which part of the fetus lies in the upper part of the fundus. So before touching the patient's abdomen or the skin, we should warm our hands because cold hands can stimulate uterine contraction. So while palpation, always use the palm of your hand and feel the baby. So if its head, it feels hard and round, freely movable and ballotable. And if it's rich or in its buttocks, it feels softer and nodular. So as I'll palpate the part which lies on the fundus is the buttocks of the baby. So let's proceed to the second maneuver, which is the umbilical grip. It is to determine the fetal back of the baby. So we have to palpate in a downward direction on the side of the abdomen and applying gentle but deep pressure to determine the fetal extremities, fetal back, and the anterior shoulder. So palpate with one hand steady on one side and the other hand exploring on the other side. We know if it's the fetal back, it has a long continuous structure that will be felt, and if fetal extremities, it will feel nodular, reflecting the portion of the fetal extremities. Okay. And now for the third maneuver, which is the pollex grip. It is to determine the presenting part and if engagement has occurred. So we have to place one hand over the symphysis pubis and grasp the lower uterine segment between the thumb and the fingers to feel the presenting part. So I feel the head is in the inlet or in the pelvis, but it is in the zero position. So the presenting part is still movable, so it is not engaged. And now for the last fourth maneuver, which is the pelvic grip, we have to turn and face the patient's feet to confirm the findings in the third maneuver and determine the flexion of the vertex into the pelvis. So we have to move our fingers of both hands gentle down on the sides of the abdomen towards the pubis. So it should look like this. Okay. So the head is flexed or optimum. And now let's locate again the back of the fetus and place a stethoscope over it and listen to the fetal heart tone for 1 full minute. So the fetal back is in the left side. So it's in here. So before placing the diaphragm, we have to warm it before touching the patient's skin to prevent uterine contraction. Okay. the fetal heart tone of your baby is 120/160 beats per minute. So it's in the normal findings. So we have to note the location, rate, and character of the fetal heart tone. So if in cephalic presentation, the fetal heart tone can be heard either in the left or right lower quadrant of the abdomen. So if in bridge presentation, the fetal heart tone can be heard above the level of the umbilicus, either left or right. Now that we are done doing the procedure, make the patients comfortable to ease and promote relaxation. Okay ma'am, humanata. So thank you kaayo sa imuhang pag-cooperate. Ang imuhang baby kay normal man iyahang pagtuyok o iyahang fetal heart tone. Okay ma'am. Now let's drape the patient. Now that we are done, let's document the observation made or the fetal findings, the fetal heart tone, presentation, position, the attitude, or whether the fetus is engaged or floating. It is to promote database for future. So for the fetal heart tone is 120/160 beats per minute, which is normal. The presentation, it is in bridge, which is the buttocks is in the fundus. The position is normal. The attitude, the head is vertex, and the baby is engaged. So that's all. Thank you.